As the Affordable Care Act dominates headlines, nearly 5 million low-income citizens are still unable to get health insurance coverage because the state they live in has not expanded Medicaid coverage, and they aren't eligible for tax credits to the federal health insurance marketplace. In Florida, where Medicaid expansion has been blocked, over 800,000 fall into this no coverage gap, many due to having low income. However, these low-income residents who live in Polk County may not have to worry about whether or not they are able to get medical treatment, thanks in part to the Polk Healthcare Plan. With us today we have Joy Johnson, the Interim Indigent Healthcare Division Program Head for the Polk County Board of County Commissioners. Thank you for joining us.
Thank you for having me.
So now, what is this no coverage gap that I keep on hearing so much about?
The state of Florida opted not to expand Medicaid, and that was one of the intentions in the Affordable Care Act. And once the Supreme Court made their ruling that that would be an option for states, that left those people that fall in from 0 to 100% of poverty. In that gap, they don't have access to health care coverage because Florida did not expand Medicaid.
Oh, well, that sounds rather serious. So now, what is the Indigent Healthcare Division doing to help people who fall into that gap?
Well, there's a number of options that people have in our county, which is what's great about our community. They can come and apply for coverage in the Polk Healthcare Plan, and the Polk Healthcare Plan currently covers people from 0 to 100% of poverty. So if they come in, we would determine whether or not they meet the eligibility criteria, limited assets, limited income. And for those people who would not qualify for the Polk Healthcare Plan, there's a number of other community agencies that we currently partner with that they would have those other health coverage options for them. Some of those include the Polk County Health Departments. There are 3 clinics for adult primary care. In Peace River Center, they have a clinic that is for adult primary care, and a number of other partners. So if it's something that they would not be eligible for in the Polk Healthcare Plan, we have partnerships for them to be able to get that coverage elsewhere.
Oh, that's amazing. Now, the Polk Healthcare Plan, how did this come into existence? Because this just seems too good to be true almost.
Well, it's a really great story because Polk County has been in the healthcare business for quite some time. Back in the early 90s, they had even administered healthcare through a county hospital. Once that hospital closed, the voters of this county decided they wanted to have some kind of arrangement for these people to be able to get care so they didn't continue to flood the emergency rooms. So the voters decided to pass this sales tax in 2004, and from that, this Polk Healthcare Plan has continued to expand, and we've been able to secure healthcare coverage with other community partners in this county.
Wow, that must be a huge tax to considering everything it's able to actually accomplish.
Yeah, it's a half-cent sales tax.
Oh, it's only a half cent.
Yes.
Okay. Wow. So what are you able to do with that half cent?
And with that half-cent sales tax, just last year alone, we've been able to help over 53,000 people obtain services in our county, and they've obtained over 150,000 services.
That's amazing.
In addition to that, we've been able to use this sales tax to leverage state and federal funding. So we've been able to bring in more money to this county through the state and the federal government to be able to secure more services for more people.
So if Medicaid isn't expanded, what happens to nearly all the childless adults that are currently ineligible?
Well, those who are at less than 100% of poverty, they have options for coverage by coming to us, and we can help them screen them for eligibility for the Polk Healthcare Plan or other community partners. And they may want to visit the healthcare.gov website to determine whether or not they would have an exemption on that tax penalty that is out there.
So the half-cent sales tax, that has been in existence for a while. Does it sunset at any point, or does it just keep on going?
It does sunset in 2019. So it would have to go back before the voters on a ballot for them to determine whether or not they want to vote to continue this program and to continue the half-cent sales tax.
Now, who are some of the partners that you work with? Because I know that you don't specifically give the medical coverage yourself. You set up partnerships with a bunch of different people in the community that you send people to so that they can get the coverage they need. Who are some of those partners?
That's right. We have a lot of medical providers. We have primary care doctors. We have specialists. We partner with all of the 5 hospitals in Polk County. We also partner with the Florida Department of Health in Polk County. We partner with Peace River Center, a lot of the mental health and substance abuse providers, Tri-County Human Services. We partner with Healthy Start. We partner with Health Councils of West Central Florida and a number of other providers who can provide some type of coverage that we may not provide, such as dental. We partner with Travis Career Center, and they have a dental program. We also partner with LVIM, Lakeland Volunteers in Medicine, and a number of other free and faith-based clinics that provide primary care to people who are up to 200% of the federal poverty level.
So this is really a partnership between the county government and a lot of different agencies and organizations in the community. I mean, this almost seems like it's a perfect relationship. You don't really hear about that very much.
Right, it is a great relationship, and we've been building on that in the past several years. And in fact, it's because of these relationships that we're looking to expand some of the services that are needed in Polk County, especially when it comes to dental. So we're excited about that.
That is great. Now, you said you had over 100 primary care providers and over 200 specialty care providers. How did you actually go about getting all these people to work together as amazingly well as it seems that you do to accomplish everything that you can?
Well, they do work together. A lot of these providers already talk within the community, and they're part of similar organizations and committees. The Dental Association, we have a Polk County Medical Association, so they're familiar with each other, a lot of them, but I see that the county's role in our program, in the Indigent Healthcare program, as somewhat of a facilitator to help build on some of these relationships and to help strengthen them. And if it's a matter of bringing these people to the table to be able to address a need, then that's a role that we're glad to take, and to be able to help them talk about it and come up with ideas and work with us in ways we can address some of these needs.
Oh, that's amazing. Now, if someone wants to find out how they can actually take part in the Polk Healthcare Plan, if they, for some reason, are in that no medical coverage gap, how does one find out more information?
Well, there's a number of ways that they can find more information on that. They can call us directly at 534-5387, and we can help set up an appointment for them to come in, and we could screen what they could be eligible for.
So now when someone actually goes and finds out more information and it turns out that they are eligible, how difficult is the process for them?
Well, for the Polk Healthcare Plan, we help them schedule their first appointment with their provider. So we kind of guide them through that process, and then they go and obtain that care. If they're not eligible for the Polk Healthcare Plan, we give them an information packet for the locations of these other clinics that they can go to, and the times that they're open and the hours that they're open. So we give them as much information as we can, and if they're eligible for Medicaid, we try to help guide them through that process of the enrollment. If they're eligible for Florida Kid Care, if they have a child that may be eligible for that coverage, we can help hold their hand and walk them through that steps of getting covered, and then they would then turn over to that program, and someone would be available to assist them with more information.
Now, I know earlier you were mentioning that there is a point where the half-cent sales tax will come back up for referendum. If for some reason it was to go away, what would happen to our community?
Well, there would be quite an impact to this community, because currently a lot of the partners that are currently funded through the sales healthcare surtax, a lot of the funding would go away for them, and they may not be able to maintain their clinics and maintain the programs that they are currently offering for people. And what normally happens is these people, instead of going to these other access sites, more than likely they would be accessing the emergency rooms for that care, and it would put us back to the point of where we were before this program was built and came about, where more people were accessing care through the emergency rooms. And that's what this program does. It tries to prevent people from going to the emergency rooms by providing access in other locations.
Now, why is it so bad when these people go to the emergency rooms?
Well, what happens is the costs go up for everybody at that point, because there is an influx of people more than what they're able to provide that care for in the emergency rooms. And so someone's got to pay for that, and that ends up being the taxpayers of this community.
Wow, I didn't even think about it from that direction, but that really is pretty serious. Now, it sounds like Polk County residents have a long history of supporting initiatives like this and understand the importance. And where do you think that comes from, that support?
this community understands the importance of a healthy community, and they're invested, and they've come together to support this effort. And so I think it's great for this county. I think it's great for the taxpayers.
I couldn't agree with you more. Joy, thank you so much for coming out and talking to us about this today. This is a wonderful initiative that you have going on, and I really hope that the community takes as much advantage of it as they can, because I know you have huge numbers of people that you're helping, and continue the great work.
Thank you.
With healthcare becoming an ever-increasing priority to the health of Polk County, the Indigent Healthcare Division's Polk Healthcare Plan is taking an even more relevant and necessary place in the importance to the health of our community. The Polk Healthcare Plan, which helps over 53,000 of our residents who are low income get access to healthcare, continues to expand and be of greater importance to everyone. If you'd like to find out more about how to either register to see if you're eligible for the Polk Healthcare Plan or to find out more about the program itself, check out their website at polk-county.net, or you can call them at area code 863-534-5387. If you call that phone number, they'll be able to assist you in finding out whether or not you are eligible for the program and what you need to do for your next steps.